Hi, this is Dr. Claybooks with Real Medicine, and today we'll be talking about Achilles injuries. In the most recent football game against the 49ers and the Eagles, Pro Bowl tight end George Kittle tore his Achilles. It happened in the second quarter, and even though the 49ers went on to victory, they will be missing a very pivotal weapon going forward in the divisional round against the Seattle Seahawks. Who is George Kittle? Well, he's a very, very good tight end, actually a Pro Bowl tight end for the San Francisco 49ers, and he will be sorely missed. He'll certainly miss the remainder of the season, even if the 49ers go all the way to the Super Bowl. So, what is a tendon? Well, a tendon is the distal attachment of a muscle to the bone. So, for example, this is our bicep muscle here. And at the end of the bicep muscle, there are tendons that allow us to pull our forearm towards us. So, a tendon allows forces to be transferred from muscle to bone to produce motion. Now, this is in contrast to a ligament. We already did a video on the anterior cruciate ligament. Remember, the anterior cruciate ligament attaches the thigh bone to the shin bone. And I actually have a model of a knee here. So this is the thigh bone, and this is our shin bone. And in between the two is an anterior cruciate ligament as well as a posterior cruciate ligament. So ligaments attach bones together, but tendons allow muscles to move bones. So that's the distinction. So, what are tendons made of? Tendons are primarily composed of water and collagen. And the primary type of collagen that you find in tendons are type 1 collagen. About 85% of the collagen found in a tendon is type 1 collagen. So, what is the Achilles tendon? Well, the Achilles tendon is the largest tendon in the body, and it comes together through a confluence of tendons by a group of muscles. So, you have muscles called the gastrocnemius muscles, which have a medial and a lateral component, and then you have a muscle called the soleus muscle. So, these group of muscles make up what we call the calf muscles. They come together to form a tendon, which makes up the Achilles tendon. And the blood supply to that Achilles tendon is the posterior tibial artery. So you may say, well, what is the tibia? As I said before, the tibia is the shin bone. And when we say posterior, we mean behind. So remember from one of the previous videos, anterior means the front, posterior means behind. So this posterior tibial artery that supplies the the Achilles tendon is behind the tibia or the shin bone. And remember the video when we discussed the difference between arteries and veins? Very quickly. So an artery is a blood vessel that leaves the heart filled with oxygen, going out to vital structures throughout the body. Once that blood is delivered to a particular place, whether it's a muscle or an organ or a tendon in this place, drops off the oxygen, and then a vein takes that blood back to the lungs and the heart to get more oxygen. So again, an artery leaves the heart, takes oxygenated blood out to the body, vein leaves these particular organs and muscles and takes that blood back to the lungs and heart to get more oxygen. So the Achilles tendon is found behind or posterior to the tibia or the shin bone. So who gets Achilles tendon tears? So the incidence of Achilles tendon tears is estimated to be about 18 per 100,000. Achilles tendon tears are more common in men, and in general, the age group where it's the most common is between 30 and 40 years of age. So if a person has an Achilles tendon tear, how do they present to us as physicians and surgeons? Like, how do they show up? A lot of times, what I'll hear is a patient will say, Doc, I heard a pop. If you are able to see on video or live when it happens, what you'll often see is a patient will look behind them at the time of the injury because it's often described as somebody kicked me in the back of my leg. That's how they often describe it. I felt like I got kicked in the back of my leg. As relates to symptoms, there's often weakness and there's often difficulty with walking. A patient will also describe pain in the heel. I must admit, I was never a very big Kobe Bryant fan, but much respect for him being able to go to the free throw line, still shoot his free throws after he tore his Achilles towards the end of his career. That's a very, very difficult thing to do in that type of situation. So shows how mentally strong and physically strong he was as a basketball player. So, how do we evaluate these patients when they come in with Achilles injuries? Well, it's the first thing we do, take a history. We discuss that, how the patient often will describe the injury or how it occurred. We do a physical examination. The first thing is inspection. We look with the eyes. We palpate, we push to see if we can feel a defect. There's that old joke, where does it hurt? Right here, doc. Right. Then we stick our finger in it. But there's a reason why we do things like that. Touching patients and palpating, as we describe it, provides information for us. And as I stated, when there is an Achilles tendon injury, when there's a complete rupture, quite often you'll be able to feel a gap there. There may be weakness with plantar flexion. Plantar flexion is when you push your foot down. Well, if the Achilles is ruptured, that's going to be extremely weak. And there also is an increase in passive dorsiflexion, as you can see in this picture here. If a person is face down with their knees planted on the bed or the examination table, you'd expect the heels and the soles of the feet to be equal. But if a person has an Achilles tendon tear, those images or pictures of the soles will not be equal. So increased passive dorsiflexion is what you can see in that particular situation. So after you get a history from the patient, after you do an examination of the patient, the next step is imaging. So there's a few different types of imaging studies that are available when evaluating this type of patient. Number one would be X-ray. Although the X-ray may not show the tendon very well, it can show associated fractures. Remember, the tendon attaches to the bone. So it's always possible that there may be associated fracture. So that's why an X-ray will be done. Another option is an ultrasound. If you do not have MRI readily available in your institution or in your office, an ultrasound may be an option to pick up an Achilles tendon tear. But the gold standard would be an MRI. Very, very good study to identify an Achilles tendon tear. So, how do we treat Achilles tears? Well, you have non operative options and you have operative options. So, one option is to brace or cast the ankle in what we call the Aquinas position. You brace them in that position so you can push the ends of the tendon back together and allow the body to heal them slowly over time. If it's an older patient or it's a frail or unhealthy patient, that's an opportunity to discuss non operative options, or it may just be patient preference. So if you have an Achilles tear and you opt for surgical intervention, it can be repaired surgically with good results. But you have to remember there's possible complications anytime you elect to have surgery. So there's always concerns about wound healing. For example, if you're a person that smokes, you can have wound healing issues. If you need to take high dose chronic steroids, that can make it difficult for your wound to heal. So there's things to be taken into consideration as it relates to potential complications if you choose to have surgery. Also, there's risk of nerve injury. There's a nerve called the sural nerve, S-U-R-A-L nerve in that proximity. So that's something to be concerned with as well if you opt for surgical intervention for your Achilles tear. So, in conclusion, Achilles tendon ruptures can be treated with or without surgery. You should have a consultation with your surgeon, ask them about the pros, the cons, risks, benefits before you decide. Treating an Achilles tendon injury or tear without surgery is quite acceptable. If you're a high level athlete, then more often than not, they will choose to have those repaired. As always, this is Dr. Clay Brooks with Real Medicine. Thank you guys for watching. Please share this with someone that you care about. If you have questions about Achilles injuries, Achilles tears, please leave those questions in the comment section. Thank you so much. Bye bye.